once again. I was on mute. Good afternoon, everybody. Yeah, thanks for joining us again for the next session. I'm literally just going to hand over to Hannah and Catherine, the two social prescribing link workers in the deal window over PCNs. So over to you guys.
Wonderful, thank you. Just want to make sure everyone can hear me first of all. Yeah, perfect. So yeah, hello and welcome to everyone on the session. It's great to have you all with us today, and we thank you obviously for taking the time out of your day to attend. And we really do hope that the session will be of some benefit to you. Before we begin, it would be great if you could actually perhaps introduce yourselves in the chat box with your name, if you are from an organisation, where you are from, and perhaps your reason for attending or what you're hoping to get out of the session. And yeah, as we go along, please do feel free to network in the chat as we go along, as it's a really good opportunity too. Wonderful. So yeah, my name is Hannah. I'm a social prescribing link worker for the Dover Town Primary Care Network, and my role is funded by NHS England. My background is health and wellbeing, and before coming into social prescribing, I had a clinical background as a physiologist. I'd also like to introduce Catherine. So if you'd like to introduce yourself, Catherine.
Hi there, I'm Catherine and I'm the Social Prescribing Link Worker for the Deal and Sandwich Primary Care Network. And prior to this, I was a housing professional for a number of years, working within extra care housing, and then I became a care navigator and worked in partnership with the NHS and KCC, bringing that forward before this role was developed.
Lovely, thank you, Catherine. So today we're hoping to explain more about our role, what it is, what we can do, what we've been up to during the pandemic, how people can utilise the service, and hopefully answer any questions from anyone watching today. So as we go along, feel free to leave questions in the chat box, which Catherine's going to keep an eye on, and I will as well, and we will come to those later on in the session. Catherine, if I could have the next slide, please. So what is social prescribing? A very broad question, and as it is Social Prescribing Day, you may already have an idea of what it is. You may have listened to some of the earlier sessions, so you may know everything about it, but there will probably be a lot of people listening who for them it is a new phrase, and we hope that we can shed further light on social prescribing and what a benefit it can be to us all and to society. And there can be quite a few definitions of social prescribing. It is often thought of as an umbrella term, but in essence, social prescribing involves helping people to improve their health, their well-being and their social welfare by connecting them to non-medical support within the community. So what that means is that social prescribing, it goes against the medical model. Rather than prescribing medication for an issue, it's about taking a holistic approach and focusing on the person and what it is that matters to them. For example, you may have an individual who presents with poor mental health, perhaps they are anxious, perhaps they are depressed, and when they visit their GP, they may be handed a prescription for medication to help with the symptoms of how they are feeling. But often this doesn't address the problem and the root cause of the problem. So through social prescribing, that person can be given time to find out what it is that matters to them. And perhaps they're anxious because, they're a single mother, let's say, with 2 young children, and, she's struggling to make ends meet and she has no social contact with other adults. A prescription of medication isn't necessarily going to address what else is going on in her life. And that lady, she needs someone to listen to her and help her link into support within the community. And that's where social prescribing comes in. And through doing so, hopefully she will be able to gain back control, feel more confident, feel better, feel more in control as a parent, contribute to society and reduce visits to the GP and lessen the need for medication. And that's just one example. And we are going to share some case studies later on to hopefully help with understanding that there is often more going on with someone than meets the eye. And we all recognise that people's health is determined by a range of factors, social, economic, environmental, and what social prescribing does, it seeks to look and address people's needs in that holistic way. Catherine, if I could have the next slide, please. Lovely. So how does social prescribing link into the NHS then? And as I touched on earlier there, social prescribing, it is an umbrella term. It's not a new concept, and it has been happening for years in many different ways and forms. And often we relate the NHS to medical work and the clinical field. And as I said earlier, social prescribing, it goes against that typical model of medicine. It looks more at personalised care, and personalised care is part of the NHS's long-term plan. Personalised health and care means ensuring that people can make more informed choices and be more involved in decisions about their health and care. And that's where social prescribing comes in, because it's all about giving us that more control and more choice about how we live, how we manage our conditions, how we manage an issue. Because as we're all aware, you know, a one-size-fits-all approach, it doesn't work. So as I said, it's all about helping people to find support for what it is that matters to them, and getting that right support at the right time. It's really important. Catherine, if I could have the next slide, please. Lovely. So are social prescribers linked into the GP surgeries? The simple answer is yes, and we are based out of GP surgeries. As I said at the beginning, the role that we do, it's funded by NHS England, and NHS England fund what are called primary care networks, which can often be referred to as PCNs. And those are the things that they employ us. So a primary care network, what it is, it consists of a group of GP surgeries working together to offer more personalised, coordinated health and social care to the people living within their areas. So what that means is that we are linked to the GP surgeries in the local areas. That's where we're based from, and we work alongside our colleagues there, such as the GPs, the nurses, the healthcare assistants, the admin teams, and so on. And we will work with patients who come under those surgeries, as well as helping those who are not registered to access the services. So social prescribers, you know, we are an integral role within the GP surgeries. Just like you'd go and see, you know, your GP or your nurse, you can also see a social prescriber. Next slide, please, Catherine. So that links us in nicely to explaining the GP surgeries that we actually cover. So as I mentioned earlier, I cover the Dover Town Primary Care Network, and I work alongside my lovely colleague Natasha. And we cover patients from High Street Surgery, Peter Street Surgery, St James's Surgery, Buckland Medical Centre and Pencester Surgery. And the areas in which we cover, there is a lot of evidence to suggest that Dover is a deprived community with high levels of obesity. And we work to try and address some of the health inequalities that do exist. And I'll hand over to Catherine to explain the areas that she covers.
Hi, so I cover Deal and Sandwich Primary Care Network, and that consists of Balmoral Surgery, Manor Road Surgery, St Richard's Road Surgery and Cedars Surgery in Deal, and then Sandwich Medical Practice over in Sandwich. And we have a population of around 48,000 patients. And my colleague, Kat Shonk, is available as well, and the pair of us work together out of those surgeries. Although that's where we're based, we do visits in other locations. So we do go visit patients at their homes or at a location that they would choose.
Lovely. So if we could have the next slide. So are there other social prescribing link workers in Kent? And again, the answer is a simple yes. We have other colleagues that cover the other primary care networks in the area. So each primary care network, which as I said is a cluster of GP surgeries, has a social prescribing scheme. And if needed, whether that's now or in the future, you can always ask us who our counterparts are in the other areas, and we'll happily link you into them. I'm sure there's probably a few that are already on this call as well, so please do feel free to introduce yourself so that you can link up to them as well. Lovely. So if I can have the next slide, please, Catherine. So you've heard me waffle on for quite a bit now, but what I want us to get back to is that question of what it is we actually do. What does it look like? So a social prescribing link worker, we help to reduce health inequalities by supporting people to unpick complex issues affecting their well-being. We enable people to have more control over their lives, develop skills, become integrated within the community. And the way that we actually do this is we give people time. We take the time to have a proper conversation with them and really find out what it is that matters to them and what they perhaps want to work on or want support with. And then we work together with that person to find the right type of support and help, and then link them into this support. As quite often the first step can actually be the hardest. And for a lot of people, you know, doing something like giving them a leaflet with a telephone number on, it's not quite enough. For some people that works, but for a lot of people it doesn't. They need to be supported to reach out and make that call, or to attend that appointment, or to join that group, or to utilise that service. And to help them, we need to also look at what's a priority. So looking at what their perhaps issues or problems, or what it is they want to achieve, and try and prioritise that with them. And in our roles, we do often come across some of the words that are on the screen, such as debt, housing, isolation, employment, and so on. And we aren't necessarily the experts in these areas. We're not trying to be. You know, there's lots of services and organisations out there, but we are there to help people understand that that is the thing that's perhaps the issue that they want help with. And then, as I said, help them to find that support at the right time. If I have the next slide, please, Catherine. Lovely. So who is social prescribing for? Social prescribing, it works for a wide range of people, including those with one or more long-term conditions. So that might be like diabetes, asthma, those who need support with their mental health, those who are lonely or isolated, those who have complex social needs which affect their well-being. And it's really important to stress that anyone can refer someone to a social prescribing link worker, and that does include self-referral as well. So even though we are linked to GP surgeries, it doesn't mean that our referrals can only come from the surgeries. In fact, they can come from anyone. And in terms of the referral process, it tends to differ for each area. In terms of social prescribing in Dover, for example, we work generally from 18 plus. I'm sure that Catherine will explain hers a little bit later. But if you do want to find out more about our referral process, then please just give us an email, and we will share our details with you at the end. But as I said, you know, we are within the GP surgeries and we're accessible. So even if someone just calls the GP surgery, asks to speak to a social prescriber, they'll be able to do so. So it's an easy service to access. If I could have the next slide, please, Catherine. Lovely. So what happens when someone's actually referred to a social prescribing link worker? Often, you know, someone might be referred, you might refer someone from your organisation, you might be thinking about it for yourself. And it's actually, you know, what happens? What's the next step? So it will vary again from area to area, but the basis is that the social prescribing link worker will have a conversation with that person to find out what it is that matters to them. We all know, obviously, the pandemic has had an impact on so many things, but also the way we work. So we have gone from visiting people in their homes most of the time, or meeting face to face, to now communicating a little bit more via telephone, text or video calls, but we're also still visiting in person when needed. But the idea behind that conversation with that individual is to really give them that safe space to open up and to build that trusting relationship, to allow them to express what it is that they would like help and support with. And then, as I said earlier, be able to work together to prioritise what they want to focus on. And it's, again, looking at that right support at the right time. And we really look to focus on them as a person. And when they present with an issue, for example, you know, they're an elderly, lonely person, not assume that for them they want to attend, you know, a day centre, for example. Or if it's someone struggling with their mental health, not assume that they need to go to counselling, but instead listen to what these individuals feel would help them and what they are interested in. For that person, you know, suffering with their mental health, it might actually be that they want to get back into employment because they want to feel fulfilled. And for them, perhaps counselling is a step, but just not quite yet. For our service, it's not time limited. It's flexible to meet the needs of the individual. And even if we do close someone at, you know, at whatever point, they can be referred back in at any time. So as we're going along, we are going to now share a few case studies to hopefully bring the work that we do to life. So feel free, as we're going through these, if you've got any questions, to pop them in the chat. And the case studies that we are sharing, we do have consent to do so, but we have protected the individuals' names as well. If I could have the next slide, that one. So an elderly, frail female, she was referred to me for loneliness and risk of falls. And when I visited the lady, she detailed how she'd had a fall recently. She'd been stuck on the floor for hours. Generally, she did struggle to move around her house. She was sort of using a frame, but, you know, she just looked like she was going to fall again at any moment. She also showed me how she would go up the stairs to bed. And this was really concerning. And we did have a long conversation about what it was that mattered to her, because the main thing the GP had picked up on was the risk of falls. But actually, through speaking to her and having a conversation, her main wish was to be able to speak to like-minded individuals. But the problem was she was housebound. You know, she couldn't really go out, and she felt very lonely. She doesn't have any family nearby. So to her, that was, you know, her real priority. If I could have the next slide, please. So what we did, we worked together to prioritise what the lady wanted to focus on. And she realised that initially this was making her safer at home. So she was agreeable to an OT referral, and they were able to assess for aids and adaptations to make her home a bit safer. So, you know, organised to have a bed put downstairs. And we also looked into the seating as well, because that's one of the things she struggled to do, was get out of her chair. So a local company came with a demo chair and she decided to purchase it. But as I said, what really mattered to this lady was not to feel as lonely as she did. So we made several inquiries into how we could support her, because like I said, she was housebound, but a local group, they were able to offer befrienders to visit her. And the lady, she really did enjoy the company of these befrienders, because they sort of shared quite a few common interests and things in the past that they were able to speak about. And this help, you know, the sort of the practical help in terms of, you know, helping with the risk of falls, but also, you know, helping to reduce her isolation. It just helped her to continue living independently, because she already had some support in place. She had a carer going in the morning, and she had a lifeline. But it helped her to, you know, to feel less anxious about falling, as she would always worry about going up and down to bed. She also told me how she enjoyed speaking to her new friends, and during the lockdowns they were able to speak over the phone regularly. And what she was pleased about was the fact that, you know, we'd focused on what had mattered to her. She knew that she needed to be safer at home. She knew she was at risk of falling, but what she really wanted was to feel less lonely. Next slide, please. And I'm just going to give some other sort of examples of the type of work that we've done. And again, this is just a real snapshot today. But there was a lonely, isolated gentleman who was referred to me, who's been quite lost. He would regularly walk his dog every day. He already had practical support from his daughter, but he just didn't feel very fulfilled. And through our conversations, he told me about his model railway interests. And through some community working, I managed to connect him with a fellow enthusiast. And he told me about how they speak over the phone, and that they now, you know, had all sort of shared their model railway setup. They've been and visited each other, and he just was feeling a lot more positive about the future. There was also a mother that I was supporting. She lost her job, unfortunately, during the pandemic, and she suffered mental health issues. And these were just, you know, exacerbated by the fact that the pandemic was ongoing. So we looked at connecting her to a gardening project, and she really enjoyed this due to the peace and quiet of the garden, as well as being able to meet others in a relaxed environment. We also referred her for a hardship grant, which she received, and this really helped her mental health, as her money worries were heightening her feelings of anxiety. And she'd also started to look into future job options. I'm now going to hand over to Catherine to go through a case study of hers.
Thank you, Hannah. Fantastic stories there of how people have been helped within Dover. Moving now to the Deal and Sandwich area. So in February last year, just before we were hit with the pandemic, I was referred a 60-year-old gentleman who had been sleeping in his car following a marriage breakdown in a village near Sandwich. He'd attended the GP practice on numerous occasions, suffering with ailments related to the conditions he was living in. We had a long conversation about what mattered to him. He explained that following the marriage breakdown, he'd become really depressed, and he'd used alcohol and was quite open to that. Although in this case, he was no longer using it as a crutch. He also suffered with COPD and asthma, which were being aggravated by the conditions that were in the car. It was quite dusty, it was quite old. He was obviously, you know, being in there for quite a lot of the day. As he couldn't fully lie down to sleep either, he'd begun to suffer with quite severe lymphedema, which is swelling and water retention in his legs. And he'd also gained lower back pain, which had meant that he basically couldn't walk evenly anymore. And he was being referred to the pain management clinic because of the level of pain that he was now suffering. So initially, like probably most people would do, I inquired if he'd sought help with housing through the local authority, and he advised that he had, but said that they'd said to him that their emergency housing was normally a B&B short term in Dover. The gentleman was really keen to remain within the village he currently stayed in. It turns out that the reason why he was so keen was actually because this is where his family were from, and his family was still based there, including his 15-year-old son. He was incredibly close to his son, and he was concerned that a move to Dover would mean that he wouldn't be able to get to spend time with him. He also confided, after we'd built up quite a bit of trust, that actually his son was his carer, and that he was able to access his mother-in-law's property a few times a week just to be able to wash, because obviously in the car there was no facilities. And his son was actually having to bathe him because he wasn't able to get in and out of the bath himself or wash himself properly. He was therefore obviously concerned that by going to the B&B, he wasn't going to get that level of care and support that he wanted. And on top of obviously it being his son, he just didn't feel that being able to present at the local authority and take up their offer of that type of property would be suitable for him, and that actually he would rather continue to stay in his car. After a lot of discussion with him about it and trying to put him at ease that putting in a referral, a homeless application and a housing application, and giving him some choices over what happened next, he agreed that we could do that. I also spoke to the GP about supporting him with a Kent agency assessment, which is something that can be done to provide additional information in terms of social or health impacts that somebody has that needs to be addressed with housing. I advised him that whilst I couldn't promise a suitable property obviously might come up quickly, I would try my best to ensure that if one did come up in the village, and that he would be in the best possible position. And by understanding the priorities of him, I was able to build his trust and get him to allow this application to be submitted. The lack of appropriate housing was obviously significantly impacting and exacerbating his health conditions. However, I was aware that just addressing his housing need could create further issues. If he wasn't in the right location, his son would not be able to visit, meaning a lack of support with his personal care and him becoming socially isolated. After 2 months, I found out that a property was coming available in the village he wanted within a sheltered scheme. I spoke to the scheme manager and Dover District Council to make sure he was on their radar. The property had 2 bedrooms, which meant that his son would also get to stay with him for support if required. I put him in contact with community services to get household items and gave details of carer support for his son to access as a young carer. I made sure he knew his benefit entitlements as well, and also made the scheme manager aware that he might need some further support in attending various routine appointments to gain those benefits. Since he's moved there, I'm pleased to say that he hasn't been back to the GP in relation to any of the ailments that he was visiting to, other than his sort of overriding ongoing conditions. And I think it just goes to prove that if you can listen to what someone's saying and support them in the right way, you can actually have the best of both worlds by empowering them and getting them to maybe do things that they otherwise feel are impossible. But at the same time, really listening to them, and that in itself can have such a positive impact on their health and well-being. Hannah, back over to you.
Lovely. Thank you, Catherine, for that case study. And it just shows some of the complexities that are sort of dealt with. And as Catherine said, so important to look at helping people to feel empowered and to improve their confidence. Lovely. So in terms of, what else do we actually do in our role? And as you've heard, we spent a lot of time working on the resilience of individuals. So, helping them to take control, build their confidence through getting the right support at the right time. But we also look at ways to improve the resilience of the local community. And this has, of course, been particularly evident during COVID-19. Which we are going to speak about, but we also want to look ahead at how we re-engage communities, how we get individuals and families reintroduced back into the community, what's going to be back out there to link our patients and ourselves into. So we're really interested today to hear from any groups, organisations or services that are here today to find out what you're going to be doing moving forwards, and also how we can spread the word about social prescribing in our communities. Next slide, please, Catherine. So I'm just going to talk a little bit about the response in Dover to COVID-19. And as we all know, it's been a massive part of our lives for the last year. And it's almost strange to think back to those early days when no one really knew what was happening or what to do. There was quite an overload of information at that time from various places, the government, NHS, and it seemed to leave everyone in a state of panic. We probably all remember the state of the supermarkets as a result of the panic buying, for example. And I remember some of the thoughts that I was having at that time back in March. Who are these shielded patients? How can we help them? How will people get essentials? Who was vulnerable, but not just in a clinical sense? How could we support people? We knew there was, work to be done and a lot of people to be helped. So in Dover, we had a response. And first of all, we knew we had to support the shielded patients. And we worked with Connect Well East Kent and Dover District Council to ensure that the list of shielded patients would be contacted via wellbeing calls. We also extended this to elderly residents. And Catherine's going to speak about these calls a little bit later on. However, since the shielding was announced, at that time, I was really conscious of ensuring that those not fitting that shielded criteria were supported. Those that were perhaps socially vulnerable, whether that be due to a low income, mental health issues, being without family support, fleeing abuse and so forth. And luckily, my thinking was mirrored by the wider community and a group of local organisations, services and volunteers. We all joined together and created the Together for Dover initiative. Next slide, please, Catherine. And I actually believe that some of the fantastic people that have been involved with Together for Dover on the session today. I just want to share the amazing response that this initiative had on the community of Dover. So Together for Dover, it started as a response to help the residents of Dover who didn't have anyone to help them. And it branched out to various areas and it grew real momentum. And as you can see from the statistics, we were able to support our residents in various ways. With the hotline in the first, in all the lockdowns combined, taking over 1,600 calls. And this resulted in over 800 errands for shopping and prescriptions, delivering over 800 hot meals, delivering over 800 fresh food deliveries. It also provided a laundry service, holistic therapy via Harmony, and provides and still does weekly befriending calls. And the initiative, it's still ongoing. It's still helping people right now. And it truly represents the community spirit of Dover, and it adapted to the ever-changing situation. And following a pause after the first lockdown, it kicked straight back into action when it was needed for that second lockdown. And this joint up partnership working, it's really set the path for the future in Dover. And the efforts of over 80 volunteers that were involved, they won't be forgotten. From a sort of GP surgery point of view, they were grateful to have somewhere they could direct patients to who needed this support. The reception phones were busy with people asking, how were they going to get their prescription? How are they going to get their shopping? And they were able to give out this number, which was a real lifeline for some. And following that first lockdown, back last year, Alison, I don't know if she's on the call today, but she's a Kent County Council community warden. Her and I, we ensured that the Together for Dover regulars followed up. So we contacted them all to work out how they could regain their independence, or perhaps for some realise that they are quite vulnerable and do need some help in day-to-day life. And the nice thing about Together for Dover is that it wasn't done, no one was involved for recognition or anything like that. It was just about helping our community with our skills and our time. However, I am pleased to say that Together for Dover were nominated by Dover District Council and Kent County Council as making an outstanding contribution to the community during lockdown. And it was really wonderful for all the volunteers to be thanked and recognised in a virtual ceremony. So yeah, like I said, I would just like to say thank you to anyone on the call today who is involved with Together for Dover. I've spotted Michelle already. It's been fantastic work that's been done. Next slide, please, Catherine. Lovely. So again, I'm going to cast your minds back to when the first lockdown was lifting. And at the time, I was looking for opportunities to connect people into the community in a safe way. And gardening seemed like the perfect option due to it being outdoors and the positive links that have been shown between gardening and improving well-being. At that time, we were able to refer 8 patients into 2 local gardening projects in Dover. And we measured the impact after 6 weeks of gardening on 2 of the patients. Both patients, they showed greater positive well-being with their scores improving. I'm also going to share some of the feedback. So one of the patients, when they were asked if they would recommend the gardening project, they said, yes, I would recommend, as many people do not have access to outside space and the chance to grow flowers and vegetables. Being with others also helps your well-being. The other patient said that they do like the way there are options like the gardening projects rather than automatically going for the antidepressants with side effects. So sort of moving forwards this year, I'm quite keen to build on the social prescribing opportunities in our local community of Dover, as we can see the impact that they can have both individually with those referred into gardening, as well as community-wide with the Together for Dover initiative. And yeah, I'd love to hear from anyone with ideas of what more we could do in the Dover area and to build on obviously what already exists as well. So I'm going to hand over to Catherine now.
Hi, so obviously during the COVID-19 pandemic, we were tasked with going outside of maybe what would have been our normal role to try and take on other aspects. And obviously a patient's health and well-being overall is our main priority. We were asked to work in partnership with Connect Well East Kent and Dover District Council to make sure that our patients who were most at risk, who were deemed high risk to COVID-19, were contacted when originally the first lockdown happened. And using all the, the people that we were able to get together with Connect Well and Dover District Council, who set up a kind of a hub, we were able to contact 1,781 patients within our area. Following on from that, in total, we were able to access an additional 9,963 patients of our 48,000 patient cohort who are aged over 70. And just asking them really the basics. Do you need any support? Are you okay to get your shopping? Are you okay to get your medication? We were able to set up for a lot of people the opportunity to get prescription deliveries that maybe hadn't looked about doing it before. As well as utilising the services that were on offer. There was the Good Sam app as well that we tried to get people involved with, and more locally we had a good neighbourhood scheme here in Deal that was working hard locally to make sure that patients had access to everything that they needed to. And I think it's really important to stress that, we had to continue as normal as best we could. The GP surgeries were obviously still open, and we had to make sure from our end that patients were able to access everything as they would have been able to before, but obviously taking into account the logistic issues with it. So we were able to support them with the hot meal packages, housing and benefits support. Befriending obviously became even a bigger component because people were no longer able to see their family and friends. And unfortunately, due to the circumstances around COVID-19, we also ended up having to supply a lot more contacts and information for bereavement support and be that initial contact for people, sadly, when they've lost someone. And I think that was really important. The unique position we're able to be in is that we actually work with the hospital discharge teams as well, and so we can find out when we can monitor our patients within the hospitals, and so we can see when a discharge is going to be likely, And then we can make sure that we give the hospital a heads up regarding their social circumstances, that we've worked with them in the past, or whether we get new information from their family and friends that can't be, getting hold of the hospital at the time. We can make sure that they're discharged with an appropriate package of care or support, which can include a 7-day appetito service or something like that, just to make sure that everything is definitely in place for them for when they came home. In terms with how we can link more people into social prescribing, as Hannah's already said, we work with a number of organisations and agencies to promote social prescribing across our communities. And as social prescribing link workers, although we mainly receive referrals from GP practices, we are now encouraging referrals from a number of other sources, including self-referrals, to make sure that we encourage active participation in combating these social issues to improve our long-term health and well-being. So we do have our individual referral forms for our localities, and if obviously you're in the Deal and Sandwich area or you work with people within this area, then you're more than happy for you to take our details at the end. The same with Hannah in Dover and all our social prescribing link worker colleagues. If you want to access their contact details, we can make sure you're put in touch with them and they can provide you with their referral form. But it literally can just be as simple as Hannah said, as picking up the phone and finding out their doctor's surgery and ringing it up and asking for us to give them a call back. It really is that simple. The aim is that we have as fewer barriers as possible to make sure that they can speak to someone and get whatever it is that's causing them the anxiety, to be able to get that help needed. Moving forward, as we've already touched on, it all starts with that most important conversation with what matters to me, and being able to have that conversation, ideally being able to give people the choice and the ability to access groups and organisations that are within the voluntary and the community, faith and social enterprise sector. Ultimately, statutory services only have a finite amount of resource, and in a lot of instances people are going to their GPs with issues that their GPs simply cannot fix. And the idea initially obviously was that they could be referred to us, but there seems to be more and more organisations who are finding the same problem, whereby someone will come to them for one thing, but actually rooted within that is a number of other issues that maybe they're not the best person to tackle it with. So being a social prescribing link worker really does give us a network and put us in a unique place to be able to support people with so many varying social issues that we really do want to help them. And that can be from simply getting someone involved into an art class because they've been passionate about it for years, and just haven't had the courage to do that and are feeling a bit isolated, to helping families navigate the process of when their loved one is coming to the end of their life and looking at care homes or hospices, and making sure that they have the support of our other colleagues in health to be able to provide that kind of support to them, and social care as well. As an integral part of the primary care network, we are able to directly work with other teams who may already be involved with a patient, and we can share information so they're not having to repeat their story. I think we all know of when we've got maybe someone who's suffering with dementia, for instance, that they don't want to have to keep saying the way they feel and the way they are and what's wrong with them again and again and again as different agencies become involved. And by us taking a lead and helping to kind of advocate on their behalf, we're able to make sure that their story is told in advance, and so that teams already know about them prior to them linking in with them. And I think that does sort of save them having to repeat the same thing and sometimes become quite frustrated. We also want to be really proactive as well as reactive. So looking at the wider determinants of health and looking, in the last 19 to 20, we've had an increase in hospital admissions for over 65s and over 80s with falls. We've got a high rate of obesity, as Hannah touched on earlier, and children as young as 5 in reception classes who are overweight. We've got a prevalence of high in terms of cancer and cardiovascular disease, and it's about looking at those areas and saying, what can we do to make our population healthier? So again, we're trying to reduce that burden right at the very beginning, get people being healthier, whether it be linking them in with the One You service or community groups, walking groups, things like that. It's how we can play our part as well in really making an effort at the beginning to make sure that people don't end up necessarily using services later on down the line. Hannah, back over to you.
Lovely, thank you for that, Catherine. So we would now like to welcome the opportunity for any questions. I know there's been a few in the chat box which seem to have been answered as we've gone along. So I don't know if anyone wants to unmute and ask us any questions, and we'll obviously try our best to answer them. And also we've shared our details there on the screen. So if you want to pop us an email about anything, then please do, just get in touch. So yeah, any questions from the floor at all? So just see if anyone's got any questions, give them a few moments to think. But Lindsay in the chat, she's asked a question: does contact with a social prescriber get noted on a client's medical records? So yeah, as a social prescribing link worker, as I said, we're all sort of based out of the GP surgeries. So we have full access to the patient's medical records. So what that means is that any contact that they have with us is put onto their medical records, so that everyone that's involved with that patient can see, what the involvement's been, what we've done. And it also means that we can have a look at what else is going on for that person and really help to build up a picture.
We've had a question from Kim. Hi ladies, are there social prescribing link worker networks? I'm thinking of our new post holder. Is there an opportunity for newbies to link network with other social prescribing colleagues? So yes, there is. We have a fantastic group here in East Kent that was formed probably around about 18 months ago now, when there was just a couple of people doing the role, and it has expanded amazingly as more and more social prescribing link workers get employed by PCNs. So we do have that service. We also have direct contact from NHS England, and they put on regional peer learning workshops to make sure that we're able to get the best kind of coaching possible. So in terms of ongoing development, we're able to ensure at a local level and at a national level, we've got all the tools we need. Just looking in terms of social prescribers, if those people that would like to know where social prescribers are, if you just send us your email address, and what I've done at the moment is I've created a bit of a directory. I'm just waiting for confirmation back. It's a first draft. We set about doing this a couple of weeks ago now here in East Kent, and it's expanded quite substantially to cover pretty much the whole of Kent and Medway, but it is very much still to be checked. So we do have something, and we can put you in touch with the overriding kind of the PCNs and the organisations who may be working within them, not maybe the actual names of the social prescribing link workers, but we can certainly get you contacts to where you need to be going, because there are quite a few practices that are employing directly social prescribing link workers, as well as those that have chosen to employ theirs using the community social prescribing organisations such as Involve, Red Zebra, Social Enterprise Kent, that have already established social prescribers within their framework. So there's the opportunity for us to be able to give that information to you. But obviously, yeah, I would like to check it first. But if you give us your details and I know who it is, then I will send it straight away to you. If not, it may take just a couple of days to get everything confirmed, but we can make sure that you've got that information. Nicola's just reminded me as well that there is the social prescribing collaboration platform as well that's run by NHS England, so you can use that as well, so any social prescribers can access that as well. Oh. So Jack's also said that he's going to be sending out a document on Monday next week with the link, so that's all good. Jack, are you back?
Yep, all back. I think that was a really, really good informative session. And when I asked Hannah and Catherine to do this, it's because even though we are heavily involved in social prescribing, the role of a social prescribing link worker has developed into such a great resource for the NHS, the community, and the voluntary sector to work with. So I thought it'd be really good and informative to bring them on and do a really good session, which they really did deliver. So thank you very much, Catherine and Hannah. And like I say, I'll be working with Catherine and Hannah in the next couple of days to kind of get some information together so we can send it to everybody. And I will also send this presentation around, if that's okay, Catherine and Hannah, to everyone on this call. And also I will include Catherine and Hannah's contact details. So if you have any further questions, you can contact them directly, and then they can send out any referral forms or whatever resource you need from that. Is that okay?
Yeah, no, that sounds fun. And can I just say, if you know of any social groups, I'm always after, I know Jack knows that I champion this all the time, but if you know of any groups in Deal or Sandwich, community groups that need people to attend, then I have got a list of patients that would desperately, like to link in with them as and when we can, after obviously once things start to open up. So if you know of any groups or services that you think would benefit any of our patients, then please do link in with us and let us know, because it is all about building up those community groups so that they thrive as much as the service thrives itself.
Brilliant. Yeah, and the same applies in Dover as well. And even if it's a fact of you knowing of groups but maybe not being involved with them yourself, even just knowing about them is great, because we all know with this new virtual world, it's hard to just have those general conversations where you hear about things in passing. So any information is greatly appreciated.
Yeah, brilliant. Well, thank you ever so much. Oh, sorry, Catherine, go on.
I was just going to say, I'm sure all the social prescribers actually out there, link workers, whoever, I'm sure they would all be championing that as well. I don't think it's just us that are unique in that. I think there's lots and lots of social prescribing link workers or social prescribers in general that, they need these groups now. So I think it's so important.
Yeah, sorry, before you go, Philip Davis has his hand up.
Yeah, well, I'm from West Kent, and we've got social prescribing provided by Involve, I think, that are based in Maidstone. And just before the pandemic, someone, I think her name was Emma Claydon, actually got someone to attend a walking group. They were quite agoraphobic, and it started off with, I think, 3 people. And it actually got that after a few weeks of going out walking with other people, I contacted him after Christmas, but before the pandemic. And through it, he made contact with people, and although he was on his own Christmas Day, Boxing Day, they all had to get together and were going out walking regularly. And because that, they set up links of like FaceTiming each other all the way through the pandemic. And it's like it helped his mental health enormously. Mm. And it was just that we find that a lot of GPs don't always advocate it as much as they could. It's it's like getting an appointment into the social prescribing link worker, because some of them were only in the GP surgery 1 or 2 days a week. Does it look as if the NHS are going to roll it out across all of Kent, or will they still use another company to provide it?
So NHS England have given it to PCNs, these primary care networks, which are these clusters of GP surgeries. They've given the autonomy to them to decide how they want to deliver social prescribing. So whether that is internally by direct, having social prescribing link workers working directly for them, or using an organisation such as Involve, it is down to the primary care networks to make that decision. obviously we're all wanting the same thing just as involved in that instance. I think it's really clear that we understand the importance of supporting people and helping them to stay active and be involved in lots of different, you know, groups or activities that might be what they want to do. And I think it's all about having that initial conversation. But in terms of referrals, as long as they're able to ring up a doctor's surgery and say, I'd like to speak to the social prescriber, that really should be all it takes. It should be that someone says, okay, that's fine. This is how, you know, we can give you partial number on to them, and we'll get someone to give you a call back. You know, that's how we like to build our relationships. I would hope that over time maybe West Kent do a similar thing, but it might be worth speaking to involve themselves and seeing if they have a referral process maybe you can feed into as well, if that's how they do it. I think everyone's different, but you know, for us this is how we do it, but we are in-house, so I wouldn't like to say for definite. But I would really hope that that is all that it would take, because it is just so important to reduce any barriers to these services for these clients. So
yeah, and they told me about University of the Third Age, that where they've got older patients, they've sort of like said to them to look into that, and a couple of them went on to language courses and just anything to be like socially more active. And it's such a brilliant service that's out there that not enough people know about it.
And I think that's the thing, it's about raising the profile of these community groups as much as it's about raising the profile as us as social prescribers, and you know, making sure that we're accessible and we're known about. It's also us being then able to promote all these groups and services that maybe aren't widely known. And I think that's a really important thing moving forward, is that we are more than happy to promote these services if we know about them, which is why we're asking again and again for people to let us know so that we can do that. Because it really does make a difference at a fundamental level. So,
well, you're all doing a brilliant job. Thank you.
Yeah, and I echo that, David, Philip. Sorry, absolutely. So thank you ever so much for everyone that's joined us today. And like I say, that information will come into your inboxes next week with the contact details of Catherine and Hannah, and then they can share, you know, what they need to with you guys as well. So we have got 2 more sessions this afternoon, and I apologise for those that couldn't get onto the link earlier. So we did send it out pretty quickly after that. So hopefully it's been a very valuable session, and it is recorded. So the first couple of minutes that you did miss, you can revisit on Monday. So thanks, Hannah and Catherine, and yeah, enjoy the rest of your day. Thank you.
Thanks, everyone.
Thanks very much. Thank you.
Thank you. It was great.
Thank you, everyone.